The AIDS Connection is a production of Conus Communications. It's being produced in cooperation with this station and 124 other local television stations across America.
This is the AIDS Connection, an all-night dialogue live from across America. I'm John Hambrick.
And I'm Renee Poussaint. In this half hour, we'll be talking about how AIDS is affecting your sex life.
Will we see more romance and less passion? Is casual sex a thing of the past?
Questions like those will be asked by people in cities across the country. In a television studio in metropolitan New York, at the Baylor College of Medicine, at the Texas Medical Center in Houston, at a trendy restaurant where young people gather on Sunset Boulevard in Los Angeles. In this studio in Minneapolis, where we also have a panel of experts to answer questions. Near the beach in Daytona Beach, Florida, and on the campus of David Lipscomb College in Nashville.
Approximately 1 out of every 25 cases of AIDS reported in the United States is transmitted heterosexually. AIDS is now the leading cause of death among women 25 to 29 years of age in New York City. How is the fear of AIDS affecting heterosexual sex life? Are we becoming born-again virgins?
The AIDS epidemic is going to tear at the social fabric of this country and have impact on this country like no one has ever thought of.
The best defense against AIDS, short of total abstinence, is to maintain a faithful, monogamous relationship. The kind of relationship in which you have only one continuing sexual partner, and that person is as faithful as you are.
The only thing that can halt the spread of AIDS right now is a change in the behavior of those Americans who are at risk.
The 80s, the singles bars, the easy pickups, I think it's all going to have to change, and we're going to have to grow up.
If you're using alcohol or drugs, you're having a real good time, you don't feel like disappointing the party atmosphere, that's the time at which people can begin to take risks that have long-term implications for their health.
I just wouldn't go for a one-night stand with somebody. You just can't do that anymore. It's not safe.
Romance is going to have to come back, and people are going to get to know each other a lot better.
From what I'm hearing with my girlfriends, hell no, I'm not going to have sex with somebody. I'm not going to jump into bed right away with someone.
I live my life as if I'm an infected individual. I would no more do something with someone else that could put their life at risk than I would want them to do to me.
I think maybe 5-10 years ago, you know, any decent woman would come up to a guy, you know, and say, hey, how about it? You know, the guy's going to go. It won't happen now. It does not happen.
It's very hard to stop having sex. You can't say, don't have sex. But until somebody finds a cure, a vaccine, something, you're just playing Russian roulette.
Looking at absolute risk, absolute numbers, based on all the data we have, the risk for a single heterosexual encounter is extremely small. But you have to think about what sorts of risk are you willing to take.
And that's the question. What sorts of risks are you willing to take? Our panelists for this half hour are Dr. Anthony Fauci of the National Institutes of Health, one of the country's leading authorities on AIDS, Dr. Bill Sherman, minister of the Woodmont Baptist Church in Nashville, and Dr. June Reinisch, director of the Kinsey Institute at Indiana University. Let's start with Dr. Fauci. First of all, how is AIDS transmitted heterosexually?
Well, it's transmitted heterosexually predominantly by the virus that's in the semen. And when the semen is deposited in the vaginal vault of the female, that's how it's transmitted male to female. Female to male, the virus has been also identified and isolated in vaginal secretion, so it's clear that it can go both ways.
It is more likely, however, that it goes from male to female rather than...
As with most sexually transmitted disease, yes, it is more likely that it would be male to female, but clearly the virus can be spread back and forth between men and women.
Okay, let's follow up on that in just a moment, but let's move on to Dr. Sherman. Has AIDS changed the kinds of advice that you actually give to young people about their sex lives?
Well, there's a variety of sexual lifestyles, Renee, as you well know, and as a Baptist minister, naturally I come and advocate what I think to be the best answer in the area of sexual activity, namely one person, one man for one woman for life. So I firmly believe the safest and most exciting way to pursue sex is through the wedding ring and all it stands for.
All right. Very controversial answer, I think, also there for some people. Dr. Reinisch, tell us how heterosexuals are reacting to the risk of AIDS.
They're reacting with fear, but not with changing their behavior. And in fact, in Seattle, a study has just shown that the gonorrhea rate has gone up again. When they've had education campaigns like in England, they found that although attitudes and knowledge are changed, the behaviors are not changing, so that in the heterosexual community, so that condom use stayed at 18%. When we look at college students, we find that although they're talking a good game, as you heard, their use of condoms is not going up. They say they're being more selective about their partners. I would maintain that that's not possible.
Okay, some very disturbing. This is the AIDS Connection, an all-night dialogue live from across America. I'm Renee Poussaint.
And I'm John Hambrick. Our subject this half hour is AIDS testing and government programs. Should there be mandatory testing? Can the results be kept confidential?
Who should pay for the treatment and prevention of AIDS?
We will hear questions on those issues from people all across the country. In a television studio in metropolitan New York, at the Student Center at David Lipscomb College in Nashville. From young people gathered at a trendy restaurant on the Sunset Strip in Los Angeles. From our audience here in Minneapolis, where we're joined by a panel of national experts. We will also talk to John Walters of President Reagan's administration in Washington, and we will talk with a group of people with AIDS and health care workers at the Baylor College of Medicine in Houston, Texas.
There is hot debate about mandatory testing programs and a growing concern about the skyrocketing health care costs for AIDS, which are estimated to reach $8.5 billion by 1991. Who pays the price of AIDS?
What do we want? Money for AIDS. When do we need it? Now. What do we want? Money for AIDS. When do we need it? Now. What do we want? Money for AIDS. When do we need it? Now.
It's time we knew exactly what we were facing. And that's why I support some routine testing.
It's highly illogical to test people like homosexuals and IV drug users for marriage licenses. Why test the whole population when the segment that has AIDS hardly ever gets married? It just doesn't make sense. That money would be so much better spent on public education.
The bottom line is that people with positive tests are going to be on a state list, and they're going to know all the time that the state can reach out and get them, and that's a position that people won't be in. The result is they won't get tested, and that'll mean that people die.
But health officials in Colorado say expanded AIDS testing right now would be a waste of time and money.
It simply wouldn't be cost beneficial at this point. The infection in that population getting married is clearly very, very uncommon.
What we want to do is test where the disease is, test where individuals are likely to be infected, and not test where they are not likely to be infected.
The number of cases of AIDS in people of all ages doubles every 10 months. The city may soon not have the resources to cope.
In Boston, AIDS patients, for their medical care, hospital medical care, require about $45,000 to $50,000 per year per patient.
The next fiscal year, we're going to spend $387 million in New York City, about $100 million of that tax levy dollars on AIDS, and that's up from $250 million last year. Our estimates are that the cost of care in New York in 91 will be around $1 billion. It could be more. I doubt it could be less. The costs are going up very rapidly, and they are reaching that level where they become very significant items in the city's budget and certainly in the health sector budget. Will New York City be able to cope with those costs? Yes, of course it will. Will that create strain on other parts of the health sector? It already has and will continue to.
Talking about the implications of this issue are Dr. Anthony Fauci, who administrates federal funds for AIDS research, Dr. Mervyn Silverman, president of the American Foundation for AIDS Research, David Lund, a gay AIDS activist attorney from Boston, and Linda Chavez, political commentator and a former member of the Reagan White House staff. Dr. Fauci, how accurate is the AIDS test? Can a person carrying the AIDS virus actually test negative?
The answer is yes, but it's very, very, very small percentage. There's generally a window of a period of time from the time you're infected till the time you develop antibody or a protein which reacts with the virus, which is the basis for the AIDS test. So there will be a period of time, generally measured in weeks to a couple of months at the most, in which you would be negative. There's also a very, very rare situation where someone further on in the illness would be negative. So the answer to your question, it's a very rare event.
But the implication would be that you should take the test more than once. Wait 1 month, 2 months before taking it.
That's exactly true. What you've done is you've opened up the Pandora's box about testing, because if you get tested now, you may have been exposed a couple of weeks ago and would be negative. And then you may get exposed later and you have to get a test again. So one test is not going to give you so-called clean bill for forever.
Dr. Silverman, some people say that the AIDS epidemic may have peaked. In your judgment, are the cost projections for AIDS treatment too high?
Well, first of all, John, I don't believe that the AIDS epidemic has peaked. I would like to believe maybe that the AIDS infection with the virus has peaked. But if that's so, then the AIDS epidemic will peak 5, maybe 10 years later.
Clarify that. I'm not sure that that's clear to everybody, what you just said.
Well, people keep thinking of AIDS and they think of the person lying in bed. What they don't think about are the number of people, maybe as many as 1.5 million, walking the streets, feeling good, looking good, who carry the virus. And those are people who 2, 3, 5, 7 years down the road, if we don't have drugs to interrupt that, will develop AIDS, very likely.
I've read that the projection is as high as 10 to 12 million people in this country could be carrying the AIDS virus by the year 1991.
I think those projections, it's hard to say.
High?
It's very difficult at this point to project what will happen with regard to infection. That will depend a lot on educational campaigns and the response to the education, whether you're going to have 10 million or just a couple of million or just relatively little more than what we have.
But we do know that the costs are high now and the costs are going to grow and they're going to be significant.
Let me go to Mr. Lund, if I might. What are the legal issues involved in reporting of AIDS test results to health authorities?
I think there are very serious legal issues regarding confidentiality and privacy issues. Just because it's going to a health authority does not necessarily protect the confidentiality. Something that appears in somebody's medical records, I know in many hospitals local to where I am, can basically be gotten by anybody who works in the medical record department. And considering the ostracism and so forth that goes along with this disease or testing positive to it, it's simply not worth the risk for somebody to take the test.
Linda Chavez, let me ask you, do you think that people who test positively for AIDS should be reported to authorities?
I think that public health authorities ought to be notified when someone is tested positively for AIDS. I think if we want to destigmatize AIDS, we've got to begin to treat it as we do other serious communicable diseases. I think that we have a much better chance of controlling the spread of the disease, and I'm sympathetic to Mr. Lund's point of view. But you've got to protect confidentiality, but you've got to know what's going on. Ignorance is not bliss when it comes to AIDS.
Okay, we've established the catalyst for further discussion later on this very subject.
We do, in fact, have the same question for you at home. Should the names of people who test positively for AIDS be reported? If your answer is yes, that results should be reported, call 1-900-210-0019. If you think results should be confidential and your answer is no, call 1-900-210-0020. We'll have the results of this survey question at the end of this half hour, so you can call now or any time in the next 20 minutes. It will cost you 50 cents to call in and vote.
Renee, at this point, we're going to go to our New York audience where a question is waiting. Yes, sir, go ahead, New York.
I'm a college student, and there's been a lot of questions on my campus on whether the AIDS testing is accurate.
Well, Dr. Fauci, you were alluding to some of that just a few minutes ago. Would you like to elaborate just a bit more and answer his questions?
What I said about the window where you would have negative obviously still goes, but one thing you have to understand, that the test, which is called the ELISA test, which tests for antibody to the virus, is a very sensitive test with the potential of there being false positives. There's a much greater chance of a test saying that you're positive when in fact you are not infected with the virus than it is of missing someone who is infected with the virus but who is negative. So one of the things you got to remember, a positive ELISA needs to be confirmed by what we call a Western blot, which is a much more specific as opposed to sensitive test. So accuracy errs on the side of actually being more sensitive than it should be.
Sufficiently answered for you, sir?
Yes.
I'm curious as to why you would ask that question. Have you taken an AIDS test, or are you contemplating taking a test?
No, not at all. I was just curious because there's just a lot of talk around campuses. We've been doing a lot of talking. I'm a communications major, and we talk about drug testing as a whole. And I was just curious because I've heard some things like they're not too accurate, especially with drug testing, too, I'm saying.
But you feel that Dr. Fauci answered your question sufficiently, and I think you can probably say that whoever says that is not correct. Thank you very much. Let's go to Houston at this point. We have a person waiting there for a question. Yes, sir. Houston?
Yes, my name is Ernie Dugas, and as a person with AIDS, I'd like to address the panel as far as who ultimately pays the price. Is it not the person with AIDS as far as discrimination in employment, insurance coverage, and housing? I would like the panel to address that.
All right.
Everybody pays the price for AIDS. I mean, all of us pay for it in terms of increased medical costs. All of us pay for it in terms of increased risk. So it isn't just the infected person who pays. Society pays the cost for AIDS.
The people with AIDS, people suspected of having AIDS, people in high-risk groups, even people who live in neighborhoods that are associated with high-risk groups pay the price for this disease. Insurance companies are redlining areas. Employers are dismissing people so they won't have to pay increased health insurance costs, disability insurance costs.
How frequent is this idea of people being dismissed because they have AIDS? There are some things that I have read that says certainly that exists, but that for the most part that companies have not resorted to that. You don't believe that?
Different companies have reacted in different ways. As education has increased, we're finding it's happening less. But nonetheless, people who are merely suspected of having AIDS are being terminated because other employees are afraid to work with them.
Okay. Renee?
Yesterday, President Reagan announced the members of a special presidential commission on AIDS and spoke about a renewed commitment.
This year, the federal government will spend $317 million on AIDS research and development and $845 million overall. And next year, we'll spend 30% more on research and $1.26 billion overall. Spending on AIDS has been one of the fastest growing areas of the federal budget. The limits on research progress today are not the limits of spending, but of the scientific process itself. Growing cultures, monitoring the spread of infection, conducting tests, all of this takes time. I wish I could say that the vast amounts of money and effort that we're putting into AIDS research will give us a cure in a week or a year or by an absolutely certain date. The truth is, none of us knows for certain just when a cure will come. It might not be until the late 1990s, might not be until later. That's why prevention and treatment are so important now. But in the spirit of hope, let's not forget a cure might possibly arrive much sooner.
The President made that announcement yesterday. We're going now to Los Angeles, where we have a young woman waiting with a question. Yes, ma'am.
What is the likelihood of marriage blood testing mandatorily including the AIDS test?
Who would like to address that on the panel?
Well, almost every state has put that on the ballot. Fortunately, in the past, it hasn't passed. Interestingly enough, in some states, they say that if you then test positive, you cannot get married, which seems a little strange, so you could go out and spread it around to more people, which isn't, I don't think, too smart. I think the point that was made earlier in the program is we're focusing attention, it's a very simplistic approach, on the least likely group to bear results. In fact, most public health officials are trying to do away with syphilis testing in marriage because it runs about $250,000 to find one positive test. That money could be much better used in educating, especially our college kids, our inner city youth, about how not to place themselves at risk.
Anybody on this panel wants to challenge that, or do you all agree?
Well, I think one of the things we have to ask is, what do you do with the test results? I happen to believe that they ought to be reported to public health centers, and I think there ought to be more partner tracing. I think people's confidentiality has to be maintained, but if you've been exposed to AIDS, I think you have the right to know that you've been exposed and be encouraged to take a test yourself to find out.
Of course, it is the difficulty of maintaining that confidentiality that is the big, big problem. We'll discuss that. We'll have an opportunity for you to challenge one another, but at this point we're going to move over to Renee. I think we have people in this audience who are also raising their hands for questions. Folks, you'll have your chance here. Believe me, you will.
You
Renee.
certainly will in just a moment. It is very clear, however, that these are highly charged issues, politically and emotionally. Standing by in Washington is John Walters, Special Assistant to Secretary of Education William Bennett. Mr. Walters is a member of the Domestic Policy Council's Working Group on AIDS. Thank you for joining us today, Mr. Walters. First question, can you explain the difference? And I think this is very confusing for a lot of people. What is the difference between mandatory testing and routine testing?
Sure. The difference would be for mandatory testing, testing would be required. Under routine testing, the test would be an expected habit, routine when you seek treatment at a sexually transmitted disease clinic, when you go into a hospital, when you go into any other situation where other kinds of tests for health purposes are taking place.
And what categories of people would fall into, say, the routine category? Are we talking about those who go and apply for marriage licenses? What would be the routine category?
Well, yeah, the recommendations that the President made through the Domestic Policy Council's deliberations included marriage licenses, people going to sexually transmitted disease clinics, drug abuse prevention clinics, and then testing for immigrants and prisoners. Of course, for immigrants and prisoners, that would be mandatory testing.
All right, now some people, I think, find some inconsistencies there, and I'm sure that our panel would like to respond to some of those possibilities. Yes, go ahead.
Let me cite an example. In San Francisco, we have alternative testing sites where people are pouring in to get tested. It's voluntary, it's anonymous. They were asked, a large number, would you come in if it were just confidential? Now, I'm not even talking about routine, just it was confidential. 60% of the gay men said no, 22% more gay men said they might not. 34% of the heterosexuals coming in said they absolutely wouldn't come in, and another 34% said they might not. If our goal is to bring people in, to get them counseled, because that's the issue, not the test so much, is the counseling. What do you do with that information? We want to make it a safe environment. If people know that my name is going to go on a list somewhere, they may stay away from marriage licenses, sexually transmitted disease clinics, hospitals, and these other places where we want people to go when they have that need.
Absolutely. So what I hear you saying is that the whole concept of testing really doesn't seem to be very positive in terms of the possibilities of getting large numbers of people to really go through it.
The issue is counseling. If our purpose is to get people in to change behavior, then we have to motivate them to come in, we have to counsel them, and part of the counseling may be testing as an adjunct, as a motivator for behavior change.
Okay. Would any of our other panelists like to respond to this whole idea of the whole government's idea about mandatory testing, routine testing, and the whole idea of testing completely? Go ahead.
Yes, just to augment on what Murph said and what Linda said, I think what we have to do is remove the stigma from AIDS before we get into mandatory testing, because once the stigma is gone...
That's a huge...
Yes, it is.
Huge.
Education is necessary and learning is necessary. We can educate those of us who know as much as we want, but we need a public that's willing to learn and willing to take responsibility for their lives.
Okay, Dr. Farris?
Yeah, I think also we should bring up the point now also of legislation to protect the rights of individuals from discrimination when they're positive. I think counseling clearly is the most important goal of the testing. Testing in a vacuum doesn't mean anything. You test to counsel, but also because of the possible discriminatory measures against people who are positive, we really have to address legislative mechanisms of protecting people's rights.
Okay. We have a number of people here in the studio who have just been aching to get their comments and questions in. Let's go to John.
This man has come all the way down from the top row to the bottom floor here to ask you.
Good. I'd like to ask a question to Ms. Chavez, if I could. Alluded a couple of times to the fact that testing should be done and reported to health departments for contact tracing, or at least came close to alluding to that, and then sort of made a simile to that as it has to do with other sexually transmitted diseases. We've shown, or at least it's never been shown, that that sort of thing has ever been effective for other sexually transmitted diseases in terms of interrupting spread of disease. What is it that you're going to do different with AIDS antibody testing that's going to make an impact?
Well, as a matter of fact, the only way you're going to stop the spread of AIDS is by changing behavior. And if a person does not know he or she is infected, they're not likely to change their behavior as dramatically as they would if they knew they were infected. I think people who've been exposed to a disease that will as dramatically affect their life, in fact, can end their life, have the right to know that they have been exposed to that disease.
We, of course, we appreciate your opinion upon that, but does other studies really support that? Does it really make a great deal of difference if a person knows their status as opposed to changing their behavior, considering the amount of money that it costs to do that amount of testing, and the expenditure could be better spent with general education?
As I understand it, there have been some voluntary programs that have done partner tracing, and it has had an impact. People have gone in when they found out that they've been exposed and have been tested. And one would hope that if you knew you were carrying a deadly disease, that you would not infect others with it knowingly.
Back to you, Renee.
One would hope that. That's certainly true. Let's go to Houston now for another question. Go ahead, Houston.
I'd like to talk about two issues. One is, what is the antibody testing really doing? And I think Dr. Mansell has some specific comments on that.
Well, I have a comment to make, and I think it's important that people should realize that the test that we're talking about is not a test for AIDS. It's a test for infection by the virus, which is a very different thing. Just because you're virus antibody positive doesn't necessarily mean that you're going to get AIDS, and it certainly doesn't mean that you have it. And many of the statements that have been made tonight, and the question, in fact, which you're being invited to answer, is wrong. It's not a question of testing people for AIDS. It's testing people for contact with the virus. The question which I would like to pose the panel, or anybody else who'd like to answer it, is how, in fact, is the country going to pay to look after the people who have AIDS who don't have funding, insurance, or money of their own? How are we going to cope with the $45,000 to $50,000 which we were told it costs in Boston, or whatever cost it is per annum to look after somebody with AIDS? What does the federal government think it's going to do about that problem, I wonder?
Actually, probably the most effective thing we could do would be to turn to our representative from the federal government. Mr. Walters, would you care to respond to that question in terms of, in fact, where is the money going to come from?
Yeah, first I'd like to go back to the question of testing. Keep in mind that 90% of the people, it's estimated, that have the virus now don't know it. That testing in places where it's been done most aggressively, such as Colorado, has a much higher rate of individuals who have the disease, or the virus, knowing they have the virus. Testing does not have to necessarily drive people underground. Routine testing in hospitals or in clinics or for marriage license can be done in conjunction with sites that allow anonymous testing. They're not necessarily mutually exclusive. But the issue is, isn't testing an important way to protect the uninfected, to tell people who have the virus that they do, and allow them to take precautions? There are three things the federal government wants to do: find a cure, care for the afflicted, and protect the uninfected.
And we're going to have to interrupt you at that point, Mr. Walters.
At the present time, the federal government
Mr. Walters,
is
excuse me just a moment.
approximately
We're going to have to interrupt you right now. I think he's having a little difficulty hearing me, because we're going to have to go to John, and he's going to carry us through to the next
Because I have a reminder that you can call and register your yes or no answer to this question should the names of people who test positively for AIDS be reported to authorities.
As we continue with our national all-night dialogue on AIDS, we have your answers to our 900-number survey question. John?
The question was, should the names of people who test positively for AIDS be reported? 72% of those who responded answered yes. 28% of those who responded answered no.
Okay, let's turn to our panel now and get their reaction to those results. 72% of those who responded answered yes, and 28% said no. Reaction.
Well, I'm a little frustrated, as I think Peter Mansell is, and I meant to bring this up earlier. It's a confusing question.
Right.
Right now, AIDS is reportable across the country in all 50 states. So the real question is, and so that is not an issue. The issue is whether people who have been tested and have been found to be positive on the test should be reported. And unfortunately, I think most of the public continues to say yes, because in some sense they feel there'll be some protection afforded them. And in reality, the only protection that's afforded you is how you deal with your own behavior.
Ms. Chavez, would you like to respond to that?
I think that the only way we're going to stop the spread of AIDS is to change behavior. I think people are not going to change behavior if they don't know how at risk they are. And we're certainly not going to be able to deal with the 90% of the people who are infected, who don't know they're infected, if they're not notified. And the way to do that is through partner tracing.
Yeah,
Dr. Poussaint. I don't think we're talking about notifying the person. I think the question you asked, should it be reported? The purpose of testing, if you're talking about changing behavior, is to counsel the individual. That individual needs to know. When that individual knows, if properly counseled and responding to the counseling, should in fact change their behavior. There's absolutely nothing wrong with that. That's a different concept than reporting it to someone else.
Okay. Mr. Lund, would you like to make a comment?
Yeah, I think what we're dealing with here is much like with sex. Yes, a monogamous, everlasting relationship is a wonderful idea, but we're dealing with people. And because we're dealing with people, I know my community certainly doesn't trust the government. We have no reason to. We've never been given a reason to. We've been given a lot of reason to distrust, however. Consequently, we don't want anything reported to somebody we don't trust or to some entity we don't trust. However, in an anonymous sense, where I just have a number, and the only person who knows that number is the clinician, and that result comes back to me, then it's up to me to report to my partners.
Absolutely, absolutely. The issue of confidentiality is something that we come back to time and time again, and we will continue on with that throughout the evening. Let's go to John.
This is the AIDS Connection, and the dialogue continues. This is the AIDS Connection, an all-night dialogue live from all across America. I'm John Hambrick.
And I'm Renee Poussaint. Our focus this half hour is safe sex in the AIDS era.
Is it possible to have safe sex? Or is safer sex the most that we can expect?
We'll hear questions and comments on this subject from people all across the map. On the East Coast, in a TV studio across the Hudson from New York City. From students on the campus of a small Christian college in Nashville. From people gathered at a popular night spot on Sunset Boulevard in Los Angeles. From our audience right here in Minneapolis, where we also have a panel of experts to answer questions. From the owner of the Mustang Ranch, a legal house of prostitution in Nevada. And from a group at the Baylor College of Medicine at the Texas Medical Center in Houston.
You know, a lot of new products and services are being offered these days, like safe sex clubs, AIDS blood test by mail, and condom delivery services. Across the nation, businesses are advertising safe sex for sale.
A man and a woman dressed as Trojan warriors are working the crowds along Daytona Beach. They're handing out questionnaires asking students what they think about condoms. The results will be used to help market the product. They're also handing out plastic cards, which a student can hand to a pharmacist if he doesn't want to ask for condoms out loud.
Safe sex, when it first came out, is, as I understand it, is nothing more than safe sodomy. It is instruction in how to have illicit sexual behavior and maybe not get AIDS.
Introducing the Risk Detector, an AIDS detection kit that will be on the market for $14.95 as soon as the post office approves it. What you have to do is get a blood sample taken, mail it to Texas with your private code number attached. A few days later, you call an 800 number and get your results. The Risk Detector is part of a burgeoning business that AIDS is prompting.
People are more conservative because, as they mentioned in the seminar, people in three-piece suits can have it.
Janice and Ava have come to this Houston bar to learn more about AIDS and to consider joining a new club called Safe Adults. Members agree to be tested twice a year to make sure they are AIDS-free. First-year membership dues, $270. The founder admits he's out to make a profit, but he says it's worth it to meet, quote, safe adults.
When a person joins our club, they have to understand that the promiscuity is out.
Nowadays, you really need to
use some type of protection with the diseases that are going around, and it's a lot of times inconvenient to go to the drugstore and purchase, you know, the condoms.
I think now it's more a matter of convenience. The word around town is kind of called Protec. You order out for pizza, order out for Protec, same kind of thing, just convenience.
Success spreads quickly. Protec has had more than 180 franchise requests.
Our expert panelists for this segment are the Reverend Dr. Joseph Lowery, National President of the Southern Christian Leadership Conference, Terry Connor, a person who has AIDS from Philadelphia, Dr. June Reinisch, Director of the Kinsey Institute, and Dr. Mervyn Silverman, President of the American Foundation for AIDS Research. Let's start with Dr. Lowery. What is your opinion, Dr. Lowery, of all of these so-called safe-sex products and services?
Well, they're popping up so fast it's difficult to evaluate them. I would say that if you insist on going out in this intense storm of multiple sex partners, that perhaps you ought to be as cautious and take all the precautions you can. If I'm going to hang off a cliff, however, I want something more substantial than a rubber band.
Well, I think that pretty much says it all. Let's move on to Terry Connor, and getting into an obviously very serious area. If you would not mind sharing with us, Mr. Connor, how did you come to have AIDS?
Well, through being with a hooker, basically. It was the first time I've ever done anything like that, and certainly will be the last time. You know, it's something I think a lot of people do in this country, whether their friends or family know about it. And it certainly is a way of getting the disease. There's no doubt about that. I'm proof of that, as far as we know. I mean, as far as I know, there's no way really to be absolutely positive that, yeah, this person gave it to you or that person gave it to you. But I paid the price, literally, for doing that.
All right. Thank you very much. We'll get back to that in just a moment. And Dr. Reinisch, we were talking about trying to define terms, and I think a lot of people are confused at this point about the difference between O positivity and AIDS.
Well, I think Merv and I will try to deal with that issue. I think what I feel people are confused about, I felt it in the audience, is the difference between being seropositive and having the disease AIDS. And I'll start with the seropositivity. That's when you take the test. What the test tells you is whether you've been exposed to the virus. It doesn't tell you whether there's virus in the blood. It tells you that the blood has responded to the virus the way our bodies respond to disease. And why don't you...
Well, and the other, obviously, is the full-blown AIDS, and we don't know how many people will go on to that. But when we talk about, we really shouldn't call it the AIDS test. It's really the HIV, the human immunodeficiency virus test.
Okay. It is not a test to see whether or not you have full-blown AIDS, and
That's
we need
correct.
to clarify that. Can people rely on practicing safe sex to prevent AIDS?
If we're talking about penetrative sex, there ain't no such thing as safe sex. There is safer sex. And Dr. Lowery was talking about that rubber band. I don't want to make it more of a problem, but you'd almost, if I want to do it, I want to grease up that rubber band and talk about using condoms and spermicide, both of them. Never one without the other, both together, because condoms, we know, don't work all the time, and spermicide can add some to the prevention. But nothing is absolute, and it isn't 100%.
Okay. Can I add to that? In a study of couples in which one of the partners had AIDS, in the couples that didn't use anything and kept having sex, 88% of the partners, whether they were male or female, became seropositive. When the couple used a condom, only 10% became seropositive. And we all believe that if you use a spermicide, but it has to have a variocide in it, that's an antiviral agent like nonoxynol 9. You have to go to the drugstore, read the cartons, and find the one with the highest amounts of nonoxynol 9 and use that along with the condom. And perhaps you'll be closer to 100% safe.
Okay.
Never 100%
Okay.
safe.
We are going to follow up on this and the rubber band, Dr. Lowery. Believe me, we're going to get back to the rubber band. But let's go to John first.
Around your neck.
So, the question that we are asking you at home this half hour relates to safer sex. Do you insist on using a condom when having sex with a new partner? You can register your answer to this question by calling these 900 numbers. It'll cost you 50 cents to call in. If your answer is yes, you do insist on using a condom, call 1-900-210-0021. If your answer is no, call 1-900-210 0023. We will have the results of this survey at the end of this half hour, so you can call anytime in the next 20 minutes to register your answer. Renee?
We are talking about safe sex for sale, and we have a question now from a member of our audience in New York. Go ahead, New York.
Yes, my question is this. Most of the condoms and everything else that's being pushed on is mostly for people in the high-risk category. What about the rest of us, for instance, who are not in that high-risk category? What is the medical profession and others doing for us?
Everybody's high risk. We're no longer talking about high risk categories. We're talking about high risk behaviors. And everybody in this country who is having sex or has had sex in the last 7 years is at risk.
Well, wait a minute. This is going to be a quick question.
Yeah, go ahead.
And this sometimes we have to get this. If you've had a mutually monogamous relationship, no blood transfusions, no sex outside of marriage or outside of your relationship for the last 5, 6, 7 years, you can be pretty sure, or if you get tested and both of you are negative, you can have any kind of sex that makes you feel good.
But can you guarantee the monogamousness of your partner? And that's something you really have to think about. The Kinsey data showed in the 40s that 50% of men were having outside extramarital relationships in the 40s.
Which means what's the percentage now?
Who knows? I mean, it's at least the same.
At least that much.
At least 50%, and it looks like the women are going from 26% up higher than they were then. So you have to be sure about your partner as well. You may be sure about yourself, Merv, but how can you be absolutely sure?
I think that's true, but I think for this gentleman, if it's high, as has been said, it's high risk behavior, not high risk groups.
Okay, I wanted to find out from this gentleman before we leave him. Do you feel that it's an imposition on you to wear a condom if you're not in a high risk group? That you should not have to go through that? Is that what you're saying?
Yes, definitely.
That's an area. Wearing a condom spoils your pleasure in sex life.
Yes.
Well, obviously it's going to be a little difficult then, should he not be in a monogamous relationship. Are you in a monogamous relationship?
Next question.
Let's switch to the rubber band. We'll give you a breather here, just Dr. Lowry.
The safest sex is developing a relationship with a person in whom you develop trust, mutual trust, reciprocal trust, and commitment, and maintain that monogamous relationship. That is the safest sex. Anything other than that is high risk. And I think he can be very comfortable in that kind of monogamous, knowledgeable, trusting, long-term, getting to know you very well relationship.
As long as the partner is negative.
Absolutely, absolutely. Let's go to Nashville now. We have another question from someone in our audience. Go ahead, Nashville.
Okay. My name is Jerry Scapatullo, Tennessee Lesbian and Gay March on Washington Committee, and I'd like to address my question to Dr. Lowry. And I'd like to know why didn't we have this program 2 or 3 years ago when this problem was considered just a gay problem, part one? And what do you think the federal government can do to specifically target help towards groups which are overrepresented among the people with AIDS, I mean people of color specifically?
Okay, Dr. Lowry, would you like to address either of those questions?
Well, the first one was why they didn't have this program. Not knowing the producers, owners of this station, I wouldn't be competent to answer that. I think perhaps our cultural perspective on homosexuality may have prejudiced us and made us not deal with it as intensely as we ought to if it only affected gays. But obviously we must now engage in intense education. What was the second part of his question?
The second part of his question had to do with minorities, as I recall, and the fact that there is a high incidence of minorities who are being victimized by AIDS.
Well, I think first of all, historically, the poor have always suffered most from any affliction, whether it be health or culture or social oppression. So that goes here. Hearings have indicated that poor people and minorities among the poorest are most afflicted. And in census tracts and near medical complexes, infant mortality rate and other health problems are high among the poor. I think the concept that the AIDS was a white gay disease made black people feel relieved and exempt. But what we're discovering is that women and children particularly are being affected from IV drug abuse and the spread through that means to heterosexual partners, to bisexual partners.
And trying to get the word out into the black community has been one of the most difficult things. We know that public health officials have been very, very concerned with, and we're going to follow up on that issue also. But before we do, let's go to Houston now for another question. Go ahead, Houston.
I'd just like to say that I think it's a frightening thought that there are now do-it-yourself AIDS tests, as they're called. One of the most important things about having an antibody test done is to have somebody that you can identify with who will give you the result, and if by chance you should be positive, who is there to give you some counseling, some help, some advice, some reassurance. But simply to ring up on a telephone and be told by some disembodied voice that you're positive is a dreadful thing, and I really think that we should thoroughly disapprove of and get rid of these scandalous, money-making, opportunistic things that are going on in our society. And I'd like to hear what other people in Houston, for a change, have to say about this. Anybody here?
I agree with Dr. Mansell. I think that that type of test, having that type of test available, is just ridiculous, because you're putting into the hands of the test may not be accurate. You don't know. That's just as bad as having mandatory testing for everybody, because what are you going to do with those results?
Absolutely. I think that's a critical point that you're making, and we're going to continue to follow up on it, and thank you very much for that. Let's go to John now for a follow-up. John?
All the new products selling safe sex might prompt a famous question asked by Tina Turner.
Connection, an all-night dialogue live from across America. I'm Renee Poussaint.
And I'm John Hambrick. In this half hour, we will talk about discrimination against people with AIDS.
Discrimination in housing, services, and jobs, and the denial of life and health insurance.
We'll be discussing discrimination with people from coast to coast. In the New York area, we have a studio full of late-night folks. In Nashville, there's a group on the campus of David Lipscomb College. We will talk with some people at a trendy restaurant in Los Angeles on the Sunset Strip, with our audience here in Minneapolis, which is also joined by a panel of experts who will answer questions. We will also talk to a group of people on Bourbon Street in New Orleans, and with a group of AIDS patients and healthcare workers at the Texas Medical Center in Houston.
As the AIDS epidemic spreads, some fear that people with AIDS might be perceived as the new lepers of our society.
The worst part is when everybody deserts you. You know, all your friends or acquaintances.
Right now it's gone to the point of neighbors walking around the opposite side of their house if I'm out in the yard. Or certain people, if they touch a letter of mine after they've seen me lick the stamp, they put on their blue rubber gloves and put it into the mail bag. We are human beings. We are not statistics. Like I said a while ago, we can die alone, but to live, we need the companionship of fellow human beings.
But I went into a county welfare office, and the security guards escorted me to a private room because they had overheard that I had AIDS and did not want me in the main lobby.
A lot of people, they hear AIDS and they run. They're very much afraid of anybody walking down the street with AIDS, and there are people who have this idea that people with AIDS need to be quarantined. And people with AIDS should be more afraid of the general public than the general public is of them, because we can catch things so easily.
You make a determination if a person is going to continue activities
sexual activities. And many compulsive homosexuals are going to. We shouldn't be kidding ourselves. They will have to somehow confine some of these people.
What insurance companies are doing in California is they're looking at the application. They are determining whether the person is single or married, whether they live in West Hollywood, who they've named as beneficiary on their application, their occupation that may stereotype a person into being potentially in a high-risk group.
I do think that AIDS-ophobia is pretty much a focus of homophobia. Oh, now I've got a reason to hate these people. It's AIDS. I'm afraid I'll catch it.
To discuss this issue, we have with us Linda Chavez, political commentator, former Reagan White House staff member, Terry Conner, a person with AIDS, David Lund, the gentleman you just saw at the end of that tape, an AIDS activist attorney from Boston, and Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Mr. Lund, if I might ask you to elaborate just a bit more on that short statement that we heard in which you indicated that you believe that this feeling toward AIDS is used by many as an excuse just to hate gays.
Yeah, I think it is. Hate basically is just a product of fear and ignorance, just as AIDS is bringing fear and ignorance. It's bringing it out, and letting people have an excuse to hate gay people, because many people, unfortunately, misdirect this and think that it's a gay disease, which it's not. It's a human disease.
I hope that we have an opportunity to discuss this a little bit more at length, the idea of using it as an excuse to hate gays or to demonstrate some ill will toward gays, because there are some indications, I think, that the general public is not feeling such ill will toward gays. Perhaps we can talk about that a little bit later. Dr. Fauci, is the real reason for discrimination, in your judgment, the fear that AIDS can be transmitted by casual contact, in other words, ignorance?
I think that's one of the reasons. I think that the misinformation that it can be caused by casual contact allows people to have a rationale for discriminating. But I also think that there's clearly, in many cases, a thinly veiled or not so thinly veiled homophobia that underlies that in many cases. So I think it's a combination of the two.
Linda Chavez, do you see people with AIDS as victims of discrimination? Do you agree with what has basically been said to this point?
I think that there is an enormous amount of prejudice towards people with AIDS. I think there is employment discrimination that goes on. I think to deny that would be wrong. I think the more difficult question you get into, and when you talk about discrimination, are the areas such as insurance. Does an insurance company that would give higher premiums to people who have cancer or who smoke or who engage in other behavior that affects their risk for disease, they charge them higher premiums. Should they also charge higher premiums to people who are at risk of getting AIDS? Those are the more difficult questions. Employment discrimination, no, we shouldn't have it. You're not at risk of getting AIDS by simply sitting next to someone with AIDS.
Terry Conner, you're a person with AIDS. Have you felt discrimination?
Well, I've been extremely fortunate. I haven't gone through some of the nightmares I've seen and read about some people. I have to thank the Lord above for sending me the friends and family that he did, because everybody stuck by me. The only incidents I've had is a co-worker. I was walking down the street one time after not working for a while, and I ran into this guy and his brother, and the one guy shook my hand, the other guy wouldn't. And I couldn't believe it, but like I said, that's the first thing that's ever happened to me, that way. In the hospital, there have been other things, minor, but definitely people afraid of you.
We'll have a chance to ask you more about that later.
Speaking of that issue of shaking hands, not shaking hands, casual contact, let's literally bring the question home. What do you think? Would you invite a person with AIDS to your home for dinner? If your answer is yes, that you would invite them, call 1-900-210-0024. If your answer is no, you would not invite them, call 1-900-210-0025. It will cost you 50 cents to call. We'll have the results of the survey at the end of this half hour. So call now or any time in the next 20 minutes to register your response.
Okay, the subject is discrimination, and there's a question from one of our panelists, for one of our panelists, I should say, coming from New York. Go ahead, sir.
Okay, speaking of discrimination, a lot of gay people have felt discrimination. A lot of people
since AIDS was first within the gay community in the United States, there's been a great deal of discrimination based on the government in terms of finding a cure for AIDS, and a lot of research hasn't been done, in my mind, because the government did not want to really take care of people who happen to be gay and did not really address the public health issues and hasn't been exploring the drugs as quickly and as fastly as they should to find the cure. I was wondering what you think of that, Dr. Fauci.
No, I disagree with that, the government has not, the public health service has not held back on anything with regard to the basic research or the clinically applied research, because this disease was predominantly a disease of male homosexuals by any means, and I think that's just not the case at all.
I suspect you have a comment, Linda Chavez.
Well, the fact is that in terms of the incidence of the disease, the number of cases that we know of, the per capita expenditure on AIDS is higher than it is on most other serious diseases, including, I believe, heart disease and cancer. Dr. Fauci, you may know what the figures are, but my recollection is that we're actually spending more in terms of per capita expenditures on AIDS than we are on some other more prevalent diseases.
Mr. Lunn, you said much earlier in the program that you had an innate distrust of government. I can't help but wonder what kind of expectations and how optimistic you are about the commission that was also alluded to, that the President named yesterday, and what it might achieve.
Well, I'm not terribly optimistic about that commission. However, I would like to address this question, because I do think that there was a connection between the fact that it initially appeared in gay males and the potential for harm that the disease harbored, compared with the amount of funding that was received, you know, from the federal government and at the state and local levels. The thing that impressed me the most about this entire crisis is because of the lack of funding, the gay community got together as a unit and has just performed countless acts of heroism and bravery to take care of what was initially our own. And we didn't stop there. We went, if it was a Haitian person or a heterosexual person or any other person, the local action committees dealing with AIDS have just been phenomenal in the work they've done and the support they've given across the board to everybody who's been sick. And one of the reasons for that is because there wasn't funding, so it had to be a grassroots beginning. Things are getting a lot better now.
We have another question from Los Angeles. Yes, ma'am.
I think the ultimate discrimination would be the idea of quarantine, which is being proposed. I would like the panel to address the impracticality of quarantining both people with AIDS and people who are infected with the virus.
I'm sure that there are people on this panel who would not only want to address the impracticality, but would probably designate it immorality. Yeah. Dr. Fauci?
There really is no real reason at all to consider quarantine individuals, either who have AIDS or who are antibody positive. The whole concept of quarantining, when you think classically of quarantining, is to remove someone from society because they may be spreading a disease in a way, for example, by the respiratory route, in which they have no way of preventing themselves from coughing, and somebody walking down the street has no way of protecting themselves. But when you have a situation in which there are consenting individuals back and forth in the transmissibility, the whole idea of quarantine is, in my scientific opinion, non-feasible, out of the question, and in many respects unethical.
I would agree with that. The only limitation I would put is that there have been some very highly publicized incidents of persons who are knowingly spreading AIDS, who have been diagnosed, and in those instances, they are engaging in antisocial, pathological behavior, and they should be restrained. But in terms of people who are simply suffering from the disease, no, there shouldn't be quarantine.
We have a couple standing by at the Texas Medical Center in Houston with another question. Go ahead, folks.
Hi, my name is Gene Markham. This is my wife, Katie. We lost our youngest son to this disease last year, and we're concerned about the discrimination that was shown against us and our entire family, and also we're concerned about those families who show discrimination against their own child because their child gets the disease, and I think this is an issue that has not been addressed enough.
Well, there are no doubt physicians here in the room who probably have seen this type of thing. Dr. Fauci, I'll start with you once again. Would you like to comment on that?
Sure. There's a great deal of variability. There's a lot of support for the most part among families and friends, but there are clear-cut incidences in which family members would dissociate themselves from an individual with AIDS. Friends would leave. That's something that just happens. But hopefully, as people become more aware and more educated as to the nature of this infection and this disease, there'll be greater understanding and an ultimate diminution of this type of unfortunate dissociation from your loved ones.
Yes, go ahead, Dan.
I was just going to say, when after I was diagnosed, my brother and his family, he has two young kids, 2 and 4, I wasn't allowed to go near them. They were scared to death, and even though it broke my heart, I understood. And they finally took it upon themselves to go out and get educated. And because they didn't want this situation to be like this, but you know, I think if I was in my brother's position, I'd have been scared to death too for my family. But once they did get the education, I hug and kiss my nephews like I would if I didn't have this disease.
Another question from New York. New York, go ahead.
Yes, I've personally witnessed discrimination by ambulance service people in taking care of a person who they perceive to have AIDS. I'm wondering what the federal government is doing about educating ambulance corps in particular who provide services to people on an emergency basis about taking care of people with AIDS.
Who wants to address that at this point?
Right now there are increasing amounts of outreach programs to educate not only ambulance workers, paramedics, police, or what have you. I've done that just as recently as last week, addressing some of the Capitol Police, the D.C. Police, the Supreme Court Police, about really what the scientific basis for the kinds of approach you should have towards someone who's infected. And I think those types of educational campaigns will allow those individuals to make judgments whereby they don't have an irrational fear and do things which are unnecessary and illogical, but on the other hand, where appropriate, protect themselves. For example, if there's a lot of bleeding, in which they would need to wear gloves and protect themselves from exposure to a potentially infected individual.
Okay, thank you. We'll turn, at this point, back over to Renee.
All right, thank you, John. As we said earlier, it can be a very isolating experience when you are afflicted with AIDS, and people with AIDS suffer not only from discrimination, but from isolation. They need their friends to help.
Winter, spring, summer, or fall. Hey, now all you got to do is call. Lord, I'll be there, yes I will. So, you got a friend. You got a friend, yeah. Ain't it good to know you got a friend? Ain't it good to know you got a friend? Oh yeah, yeah, you got a friend.
In the heart of the legendary French Quarter of New Orleans. With us there is Dr. Ruth Coker, who is professor of law at Tulane University. And would you introduce, Professor Coker, the gentleman who is with you? The name of the person who is with you.
What's your name? Randy. Randy Giddings. Sorry. I didn't know his last name. Sorry.
Okay. Thank you, Professor. And I apologize for asking you to do my job. That is really my job. You are an expert in the area of working on discrimination against gays and against people with AIDS. I've already jumped ahead with my question. My question really has to do with what David Lund was talking about earlier. How much of the discrimination that we see is really homophobia, is really an excuse to be anti-gay, as opposed to a real genuine concern about AIDS, for instance, and health issues?
Well, what I've seen here locally and nationally is that much of the discrimination is against people on the basis of their sexual orientation rather than simply a fear of getting AIDS. What we're seeing a great deal of is that oftentimes people are routinely tested or denied health insurance or whatever because they're perceived as being gay when there's absolutely no reason to believe that they have AIDS or might contract AIDS. So I would say that a substantial amount of the discrimination that I've seen has to do more with fear of association of gays with AIDS than actually with the fact that someone might have AIDS.
Okay. Can we ask Randy, who is sitting next to you. Randy, could you explain to us what happened with you in the issue of discrimination?
Well, there are many areas that I have observed, many kinds of discrimination. And for myself, when I first became ill and was hospitalized for 2 months, I received a letter from my employer who I worked for a full year without missing one day of work. A letter, not a word in person, that I was terminated. While it was not spelled out whether or not I was terminated because of AIDS, I cannot think of one other reason why I would have been terminated, since I had been told up to that point that I was an ideal employee.
Are you taking any legal action?
No, at this point in my life, I'm trying to fill my life full of positive concerns. I'm trying to take the kinds of discriminations that are around me and people like me with AIDS and turn them into something positive. I realize that this section is referred to as the new lepers. I personally don't consider myself in that light.
Okay, very positive thought, and thank you for that. Let's go now back here to our audience in Minneapolis, and we have a question. John?
Renee, this lady has just been chomping at the bit all evening long in every segment. Go right ahead. You have your shot.
We need to distinguish between unfair discrimination and fair discrimination. We do have to have some fair discrimination. We do have to distinguish between homosexual anal intercourse, which causes AIDS, and normal sex. We can't keep covering up the truth. And we also have to admit that homosexuals have many other diseases besides AIDS.
Ma'am, let me stop you at this point, because I did think that you were going to ask a question. Yes, ma'am, I'm afraid I'm going to have to stop you.
Reservoir of a host of contagious diseases, and I'm not talking about Terry. Terry's an innocent victim. I'm talking about the man next to him and all the other people who have HIV positive.
I think, and we're going to ask you this. We're going to ask you. We thought you were asking a question. I'm going to have to remove the mic, and we'll move on down this way and back to you, Renee.
Show on AIDS. You talk down to the people. You act as if people don't know the facts of life. You act as if nobody's ever heard of anal intercourse.
Ma'am.
This poor man went to a prostitute who had been victimized with anal intercourse. That's how he got it.
Ma'am, do you realize at this point that you are taking up the time of this program with your dissertation?
Legalization of prostitution.
And this
so we
is
can
unfair
check
to
these
everyone
women.
else in this room.
And it's
do you
unfair
understand
to the public for what you do to the public by pretending there's nothing wrong with homosexuality. You're afraid to say
Would you
there's
stop at
anything
this
wrong
point?
with it.
We're going to have to ask you to stop.
You're afraid to say it's wrong, aren't you?
No, ma'am, I'm not
And
afraid
it
of
is
anything.
wrong.
I'm afraid that I'm going to ask you to sit down and please conduct yourself in a different way. Let's go back to Renee at this point.
Okay.
And, folks, we apologize for this little inconvenience.
Okay. We said this was a live show. This is a live show, and this is the kind of thing that happens when we're doing live television. All right, let's move on, and we have a number of questions. And next, we are going to Houston for another question. Houston, go ahead, please.
I'm Dr. Earl Shelf. I teach medical ethics. It seems to me that this lady has an anal fixation and not the facts about the way in which it is contracted. Neither does she have an understanding of the cause of disease. It's a virus. It's not a behavior. Now, I want to talk to address another issue, if I can. It's all very well and good to talk about instances of discrimination and hysterical calls for quarantine. That's all well and good, but it doesn't address the problem of how we're going to limit the spread of AIDS and respond to those people who are presently suffering. Indeed, discrimination or unjust discrimination based on irrational fear or based on prejudice is immoral. It should be condemned as such, and our law should be revised to protect people who are indeed infected with the virus and suffering from the discrimination of an ignorant and fearful public and a very weak governmental response.
Doctor, I think you made a number of very important points, some of which was missed because of the reaction to your initial assessment of our last questioner as having a problem in terms of an anal fixation. And I hope that we do not lose the importance of the point that you were making in terms of all of us needing to better understand the questions and the issues. And if there was a point that you made shortly after your assessment of our questioner that you would like to repeat, we did not want to cut you off. Would you like to just very briefly summarize your point?
Well, I think the point is simply this. Fear, and which breeds discrimination, prejudice which breeds discrimination, is immoral. It ought to be condemned as being immoral. And our governments at various levels should enact legislations to protect people against unjust discrimination. We've done it for black folks. We've done it for other folks who have been seen to have been victimized by fear and irrational prejudice.
Very, very important.
And we should act quickly.
And I'm sorry that I'm going to have to interrupt at this point. We will go now to John.
Actually, I don't think I have to remind the folks, but I will anyway. The 900 number question for this half hour is, would you invite a person with AIDS to your home for dinner? Now, you can call in with your response.
We are back with our discussion of AIDS and discrimination.
And we have the results of our 900 number question, would you invite a person with AIDS to your home for dinner? This is the closest numbering that we've seen so far. We must emphasize, of course, it's not scientific, but nevertheless, 51% of those who responded answered yes, 49% of those responding answered no.
And I have a feeling that I know that there was at least one member of our audience who voted no, she would not invite a person with AIDS to her home for dinner. I just have a feeling that I know which one. But she raised some very, very serious issues and some issues that we need to get some clarification on. And let's turn to our panel now to help with some of that clarification. Dr. Fauci, you had a point you wanted to make.
Yeah, I think in light of that extraordinary outburst, I think from a scientific standpoint, it should be really established so that everybody understands that there's nothing intrinsic about homosexuality that has to do with AIDS. And her response was a very good example of the kind of discrimination that we're talking about. This virus can be spread by anal intercourse, it can be spread by vaginal intercourse. So if that woman has engaged at any time in her life in vaginal intercourse with an HIV person, she would be at risk. So to say that, in Africa we know the major modality of transmissibility is heterosexual sex, and it's through vaginal heterosexual sex. There's no correlation between anal intercourse among heterosexuals in Africa and the transmissibility. So scientifically, apart from the emotional outburst, she's completely wrong.
Mm-hmm. Other responses? Ms. Chavez.
I would just say in the interest of fairness that there is one factor, promiscuity, which has been identified. The male homosexual community in the United States 10 years ago was a more promiscuous community than the heterosexual population. That studies have shown that. And that promiscuity does, in fact, whether it is heterosexual or homosexual promiscuity, does, in fact, aid in the spread of this disease, as in all sexually transmitted diseases.
Mr. Lund, would you like to respond?
Okay. I'm not an expert on the vagina or the anus in transmission, so I won't respond to that. But I think that the creature who exploded here is a good example of the type of discrimination that's out there. Perhaps a little loud. No, I'm not saying she's the majority. Don't get me wrong.
But the issue of homophobia, I think, was very realistically dramatized. And again, it was live television, and that's what we sometimes have.
The only other thing I think should be gotten across.
And live television can get hot.
And we're going to have to interrupt. Go ahead, John.
This is the AIDS Connection, but the dialogue will continue.
You've heard the saying, what you don't know can't hurt you. When it comes to AIDS, what you don't know can kill you. 1.5 million Americans now have the AIDS virus. In 4 years, it could be 15 million. AIDS is a fatal disease, so until a cure is found, the only protection you have is education. Now this information-packed video could save your life. Hosted by Jack Palance, it tells you how AIDS is transmitted, who is at risk, the symptoms, and more. Prominent medical researchers talk about prevention, treatment, and the search for a cure.
While we all look forward to the discovery of a vaccine, education and common sense are the only preventative medicines we have.
Don't let ignorance kill you. Call this number to order your tape, 1-800-633-8000, or send $29.95 to this address. A portion of the proceeds will benefit AIDS research. Call 1-800-633-8000. All major credit cards accepted.
The AIDS Connection, an all-night dialogue live from across America. I'm John Hambrick.
And I'm Renee Poussaint. Doctors, dentists, nurses, hospital emergency workers, and paramedics are increasingly concerned about AIDS.
What is the responsibility of the healthcare industry in treating AIDS?
We'll see what people have to say about AIDS healthcare around the country. On the East Coast, we'll get questions from a TV studio audience just across the Hudson River from New York City. At the Baylor College of Medicine at the Texas Medical Center in Houston, we'll hear some questions from a group at a restaurant in Los Angeles on Sunset Boulevard, and from our own audience here at our home base in Minneapolis, where we will have comments from our national panel of experts. We will also look in on a typical big city emergency room at Detroit Receiving Hospital, and we'll talk to students at David Lipscomb College in Nashville.
What precautions and protective measures are healthcare professionals taking? When it comes to AIDS, let's see whether the doctor is in or out.
Rubber gloves and surgical masks are in fashion for California dentists. As the number of AIDS cases rises, more and more dentists have become concerned about putting their fingers in the mouths of patients who could be infected with AIDS.
The concern would be contact with the patient's blood or saliva. Any dental treatment that involves bleeding, such as an extraction or cleaning, you really have to be concerned about that and protect yourself. Also protect patients that are coming in later.
This concern has prompted some dentists to refuse treatment to infected patients. And in turn, many of their patients aren't telling them they have AIDS.
To protect himself from exposure to all communicable diseases, including AIDS, Duran wears this special outfit while embalming infected bodies.
We use two gloves. We use the small surgical style gloves, and then the heavier gloves on top. We have a mask, head cover, then we have a full coverall.
State law enforcement officers investigating violent crimes must now don rubber gloves, surgical masks, and this space-age-looking suit made of paper and plastic. It's designed to protect agents from the AIDS virus at crime scenes.
I feel like that I am protected with the gloves and the mask more so than the suit itself, but that just protects. If blood splatters on me, then I can easily dispose of it rather than a lab coat or my regular clothes.
To brush up on precautions, about 40 of Metro's 150 paramedics and EMTs met this morning with their medical advisor and an AIDS expert.
They need to be wearing protective clothing on all cases, not just potential AIDS cases.
I was in a seminar with my colleagues, and these were nurses that should have known a lot about AIDS, and either they are so afraid, because it is a frightening disease, the consequences are almost universally fatal. They are not taking the time to properly educate themselves.
With us to discuss health care issues are Dr. Mervyn Silverman, President of the American Foundation for AIDS Research, Dr. Anthony Fauci of the National Institutes of Health, and the Reverend Dr. Joseph Lowery, National President of the Southern Christian Leadership Conference. Let me start with Dr. Silverman. It was recently reported that there were 3 healthcare workers who contracted AIDS after being splashed with infected blood. Would current protective measures have protected them?
In almost all cases, the guidelines that have been put out by CDC and other groups from almost day one would have helped to protect. I have to say that there is no absolutes, because someone could come into the emergency room and you could be standing there and you get splashed with blood. But I think there is general sloppiness in most clinical and hospital settings, and people have to understand, as was discussed on the tape, if you think you're going to be in contact, if you know you're going to be in contact with blood, feces, urine, it would be wise, regardless of who the patient is or who you think the patient is or might have, to wear gloves if that's needed. If you think you're going to be in a situation where it sprays, goggles, mask, whatever you need to protect yourself from that blood contaminating you.
Okay. Dr. Fauci, are healthcare professionals who treat people with AIDS more likely to contract the disease?
The answer is yes. It's still a very, very small percentage. Healthcare workers, by virtue of the fact that they are exposed to the blood of individuals, they do stick needles in and have to manipulate the patient. There's the possibility that they will get stuck with a needle and get blood from a patient who's HIV positive injected into them. Even if they do, that risk is very small. In fact, of the data that's been collected so far, if you stick yourself with a needle from an AIDS patient that's HIV positive, there's less than a 1% chance that you will get infected. The number is approximately 0.6%. That's a very small risk, even if you are directly inoculated, but that risk is still greater than the general population. So the answer to your question is small risk, but nonetheless greater than the general population for healthcare workers.
Okay. Dr. Lowry, we're going to move now very briefly into the area of really ethics, morality, what have you, because the question is, should healthcare workers be allowed to refuse to treat people who have AIDS?
Well, that's a difficult question. All jobs have hazards. Understandably, some have more hazards than others. Police officers take risks. Their lives are in jeopardy. Firemen, many others. So that health workers have risk also. From an ethical, professional perspective, it seems to me that if you choose to work in that area, you must take advantage of all the training and measures offered you to protect yourself. But it seems to me then you're ethically and professionally obligated to minister to those who are ill, who need your service.
Okay. All right. Thank you very much, Dr. Lowry. John?
Very shortly, we're going to talk to some healthcare workers about this very thing. Right now, we want to ask you the same question at home. Should healthcare workers be allowed to refuse to treat people with AIDS? If you think that healthcare workers should have that right to refuse treatment, call 1-900-210-0026. If your answer is no, call 1-900-210-0027. It's 50 cents a vote. And we'll have the results at the end of this half hour. So call now or within the next 20 minutes. Renee?
We're going to go now to one of our remote areas for a question. Let's go to New York. Go ahead, New York.
I'm a nurse. My question is, will healthcare workers eventually be considered a high-risk group because they have taken care of AIDS patients?
Could you clarify a little bit more? What do you mean will be considered a high-risk group by whom? By insurance companies? By who are you talking about?
By insurance companies, yes, or by the general public.
All right. Would any of our panelists like to
I would
respond?
doubt that seriously. Again, you have to get back to high-risk group, which is not an appropriate term, versus high-risk behavior. I don't believe anyone can construe that healthcare workers are practicing high-risk behavior, even though the possibility of getting infected, as I mentioned a moment ago, is greater than the general population. With the appropriate precautions, it is still a very, very rare event.
Okay. Dr. Silva?
Yes, I think we tend to take the exception almost and make it the rule. I mean, the media does this, the headlines do it. Probably there are 1 million contacts a day, every day, between healthcare workers and people infected with the virus. We know of 10, there could be 10 times that number. We're still talking about a small risk. And the point is, as I think was said, there's no such thing as a risk-free environment. Getting into the medical profession, healthcare profession, has attendant risks, and we have to understand that and act accordingly.
Okay. We now go to Nashville for a follow-up question. Go ahead, Nashville.
Small risk or not, I'm an emergency medical technician here in the state of Tennessee, and I deal with accident victims every day. And a lot of times, of course, there's blood involved. Now, the state has required that we wear rubber gloves when handling bloody situations and also pocket masks when doing mouth-to-mouth resuscitation. Now, you know, there's still a problem, I think, that we're taking some risk. And even though the gloves are there, what if we wipe our face and get infected blood in our face? I think that emergency care workers undergo a lot of stress every day in a lot of situations, and I don't think they need this extra thing. What kind of precautions are being taken?
All right.
Well, again, gloves, as the gentleman mentioned, the appropriate kind of attire when you're dealing with an actively bleeding person is the best type of precaution that you can take. Even when you presume, when you go on the side of an accident, you don't know if a person's positive, you should presume that they are. We're having some data that's accumulating from emergency rooms, such as in Johns Hopkins Hospital, where, you know, 5% of the people who come into an emergency room are positive and 3% of the trauma victims. I think anything more than the gloves and the appropriate draping is really not necessary. There isn't much more that you can do apart from avoiding taking care of the person, and that it would be unacceptable.
I think that what we're dealing with here is the kind of fear that he's talking about in terms of being an emergency worker in an everyday situation and feeling that you almost have to be superhuman in a sense to constantly 100% guard yourself against the possibility of making one mistake, of wiping your face with
But the risk of that, Renee, is minuscule. In biology, you can never say 100%, but the risk of getting infected where you have someone's blood and you just wipe your face inadvertently is so small as to be almost unmeasurable.
Okay. With that assurance, let's go now to John. John?
It is taken for granted in our society that doctors take an oath to treat any and all persons in need of their services. Here is what the Surgeon General of the United States has to say about that.
I think that there is a very strong responsibility for healthcare workers to behave according to the Hippocratic tradition and to treat patients who have AIDS. If I were still operating as a surgeon today, I would certainly treat AIDS patients. I would like to know which ones had seropositivity so that I could take the extra precautions that one should take in dealing with a person who does have the virus. Now that might sound like a funny thing to say. You could say, why don't you take the same precautions with everybody? Well, the fact of the matter is, if only 1 or 2% of people in a surgical community are carrying the virus, you should spend all your time being careful about those patients, and for the others, relax a little bit and just do what you usually do in an operating room. An operating room is tense enough as it is without thinking I might die because of what I'm doing here.
All right, let's go now to Los Angeles for a follow-up question. Go ahead, Los Angeles.
Recently in the Los Angeles Times, I read that a considerable amount of health professionals were coming down with the AIDS virus. I'm interested in knowing what the common cause for this is. Is it due to puncturing with a needle, or what's the most common cause?
Okay, which of our panelists would like to address
I'd be happy to. First of all, her information is wrong. The numbers are very small. In fact, we have, I think, 10
there's
documented.
6 by IV, 6 by percutaneous inoculation, 3 splashes for a total of 9.
So we're talking about a small number, but obviously a needle from a patient gets stuck in your body. One could look at it as sharing needles. So the risk is, I mean, that's a direct blood to blood, or the potential is there. That would certainly be the highest risk. But even looking at these risks, we're still talking about 10 documented cases out of millions of contacts every day.
Does it surprise you, considering the small number of people who have actually caught AIDS through this mechanism, does it surprise you the reaction amongst the healthcare workers to this whole situation?
Well, I think healthcare workers are just as human as everybody else, and unfortunately they tend to think possibly more from emotion than intellect. If they will listen to the facts, believe them, which is a problem with some individuals, but if they will really listen to the facts, understand the epidemiology and the transmission, they should still be scared enough to take good infection control guidelines, follow those. But I think it would be a shame, and I think it's tragic to see them backing away from care.
Yeah, we also have to make sure we understand that the distribution of risk behaviors, such as male homosexual activity, among healthcare workers is not significantly different from the rest of the population. So you can have a healthcare worker who gets infected and gets AIDS, but doesn't get it through what he or she did in the healthcare environment. And what that individual who asked that question may feel is that she's hearing about doctors and nurses or what have you that wind up getting infected with the virus. They're human, they have activities just like the rest of the population, so they very well may have gotten it through other types of risk behavior.
I think we also have to say that the number of health workers who are in distress over this issue is a very small percentage as well. And most health workers are going on treating AIDS patients courageously and steadfastly and with a great deal of commitment. And those who are frightened and tend to panic here represent a very small number.
I think, however, what is gripping the public is that they are so unused, if there is such a word, to healthcare workers saying that they do not want to treat certain categories of patients, that it raises a general fear amongst a lot of people because it's sort of opening a Pandora's box.
Well, I think
at what stage will I have a disease, for instance, that healthcare workers will say, well, I don't want to be involved with that. I don't want to be, you know, and at the same time, they have some legitimate concerns, obviously. So it's difficult to balance those two imperatives. And before we try and do any more of it, we're going to go to John.
More on the impact of AIDS on healthcare professionals right after this.
Help me if you can, I'm feeling down. And I do appreciate you being round. Help me get my feet back on the ground. Won't you please, please help me, help me, help me.
This is the emergency room at Detroit Receiving Hospital. Two people who work with trauma cases there, Dr. Cynthia Shelby Lane, emergency medical specialist, and Carrie Spann, a paramedic with a private ambulance service. Doctor, if I might ask you just right off the bat, are staff fears of AIDS a particular or significant problem at your hospital?
Our staff views a particular problem
Yes.
at our hospital?
Do you view them as such?
No. At the current time, most of our staff is pretty much aware of the risk of exposure and how to protect themselves. There are some concerns among those individuals who have not had the proper education, but at the current time we are trying to make that information available to all healthcare workers in the emergency department as well as throughout the hospital.
What is the process of making that information available? I understand that you're at this very time involved in assimilating a kind of protocol for your facility.
Correct. I am working with the infection control department at the hospital, and through their guidelines, which helps us learn how to protect ourselves from all sorts of diseases, bacteria and viruses as well, we are establishing and have established guidelines for the protection of healthcare workers from the AIDS virus.
Are the guidelines that you are establishing at your hospital at Detroit Receiving any different than might be expected at any other facility?
I think the infection control guidelines have been those guidelines that are consistent with the Department of Public Health as well as the Centers for Disease Control. So in essence, they're generic guidelines, and they include the use of protecting yourself when exposed to needles, blood, and body fluids, and using gowns, masks, gloves, or protective goggles when it's felt necessary by the healthcare worker.
Has anyone on your staff just flat out refused to treat an AIDS patient or someone believed to be an AIDS patient?
I haven't seen that happen.
How would you handle that if it came up? What is the proper way to handle that, in your judgment?
Well, it depends upon the person that's refusing treatment. I haven't seen a professional in terms of a doctor or a nurse or a paramedic at this point refuse treatment for a patient. I would imagine that there are a number of physicians available as well as nurses to provide care. So if a particular individual did not want to provide care, that there are a number of other people that could. And then that issue would be taken up with the employee at a later time.
Carrie Spann, if we might direct our next question to you. I assume that you have heard some of the conversation that has gone on here in the last several minutes. Have you faced any particular situations where you had an exceptional amount of trepidation in dealing with someone destined for the emergency room?
No, not myself. If you know the proper procedures, you can deal with anything out there. It's not like that when we haven't had any infectious diseases before. There's been meningitis, there's been hepatitis. You have to know what you're dealing with and then go from there.
You feel relatively safe as long as you take all of the precautions that have been talked about here tonight, and I assume that you do?
I do. As long as I know what's going on out there, I can take the proper precautions to protect myself and the patient also. It's important that the family lets me know what's going on and not try to conceal anything.
We have a question from here in our Minneapolis audience.
Okay.
Renee?
Yeah, we're standing back here. We have a young lady over here who had a question, and as I understand it, the question has to do with how the process of infection happens, how these emergency workers get infected. Go ahead.
I'd like to know, the health workers that were splashed, did the blood seep through their pores, or did they have an open wound, and how much would it take, or did it take, for them to get infected?
Okay, I think Dr. Fauci?
Yeah.
We don't know for sure, but it is likely that the large amount of blood in the 3 healthcare workers who recently were infected with blood splashes because of either small chapped portions of the skin or sores that were not really gross sores, that the virus-infected cells seeped through there. There's no evidence at all that it can go through intact skin, so we had to presume that when it was splashed on the mucosa or on the hands, or when one of the nurses was pushing her hand on an artery that was bleeding without a glove, and she had a lot of blood on her hand, it could have gone through one of the many small cracks in the hand. That's very likely the mechanism of that.
Dr. Silverman, you had something.
John, I'd like to make one comment. I disagree with the doctor in how you take care, or how you deal with employees that refuse to take care of patients. My feeling is, very simply, they should be counseled, and if they continue to do it, they should be fired. I think we have an obligation to take care of our patients, and I think we must do it. It's AIDS today. I don't know what it'll be tomorrow. It's been said by the paramedic. There's been hepatitis, meningitis, TB, many things. The healthcare profession, as I said earlier in the program, is not a risk-free environment. If you don't want the risk, get out.
Doctor in Detroit, would you like to respond to what Dr. Silverman said?
Well, I agree with his comment, and I do agree that employees should be counseled. I'm talking about dealing with a patient in an emergency situation. If, in fact, there is an employee or healthcare worker that does not want to deal with the patient in that emergency situation, there's really little you can do. You take care of the patient first, you use all available manpower, and then counseling comes later.
You, in other words, like Dr. Silverman, Dr. Lane, you would counsel that person perhaps, and then if that person did not heed your warning, out.
Most definitely.
Users who share needles. But AIDS is spreading to other people, to babies, to blood transfusion recipients, to heterosexual partners.
What you may be wondering is, what are your chances of getting AIDS?
We'll hear questions and comments on this subject from people all over the country. On the East Coast, from a television studio in metropolitan New York, at the Baylor College of Medicine in Houston, where we have a group of people with AIDS and healthcare workers. On the West Coast, from a trendy restaurant on Sunset Boulevard in Los Angeles, from our audience here in Minneapolis, where a panel of national experts is also available to answer your questions. We will also talk to some young people near the beach in Daytona Beach, Florida, and to students on the campus of David Lipscomb College in Nashville.
Under discussion is the spread of AIDS to the heterosexual population. You cannot help but wonder, could this happen to me?
I go to a gym 3 and 4 times a week. I'm a health nut. I've never done drugs in my life. And the man that I thought that was sitting home being as nice as I was obviously doing other things, and he infected me.
My son's dying, and I've had to come to grips with that.
Johnny is being cheated out of life by a tragic mistake. He was accidentally transfused at birth with AIDS-contaminated blood.
My doctor tells me that I have contracted AIDS, that I received it from a contaminated blood transfusion 5 years ago when I had open heart surgery. I don't know how much more time I have, but I want to spend it doing everything I can to protect others from falling under this deadly spell.
Now, researchers at the National Institutes of Health have confirmed that when a mosquito draws blood from an AIDS victim, the AIDS virus keeps living in the mosquito. They have not proven, though, if that mosquito can then pass the AIDS on to the next person it bites, the way it transmits yellow fever. One good sign, in AIDS epidemic areas of Africa where mosquitoes bite all ages, children who are not sexually active are not getting AIDS.
The ultimate rate of spread in heterosexual communities in the United States will not be anything like it was in gay men or in African heterosexual populations.
Sunny Sherman, a heterosexual woman who discovered she contracted AIDS from her fiancé last year, is walking proof no one is immune.
I didn't think it could happen to me, and it did.
It certainly did. We should mention that Sunny Sherman has since passed away. Our panel for this half hour includes Dr. June Reinisch, director of the Kinsey Institute, Terry Connor, a person with AIDS who lives in Philadelphia, Dr. Joseph Lowery, national president of the Southern Christian Leadership Conference, and Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. And let's start with Dr. Reinisch. What, Dr. Reinisch, is the major cause of the spread of AIDS to the heterosexual community?
Well, it's contact with IV drug users, prostitutes, and other people who have had both contact with male and female partners. It's hard to say which is the highest in the sense that we don't really know, for instance, how much bisexual behavior, in quotes, I put that, there is. There are certainly a lot more people who have interaction with both sexes than most people are aware of. To give you an example, 70% of gay males say that they have had at least one interaction with a married man, and 20% say they have had interactions with 6 or more married men. So that gives you some idea of the crossover.
Let's turn to Terry Connor now. I would assume that most people, when they understand that you have AIDS, assume that you are either homosexual or bisexual.
I guess.
And in point of fact, you received AIDS in which way?
From hooker, prostitute, however you want to call it.
Did you ever think that you could get AIDS from a prostitute?
No, this couldn't happen to me. And I say that in jest, but, you know, I never heard of AIDS, probably when I contracted it.
When was that?
I'm guessing somewhere around 3 to 4 years ago.
And at that stage, it was still very much considered to be a gay man's disease.
Sure. I made as many jokes about it as everybody else at the time until it hit me.
I think no one's joking about it now. Let's turn to Dr. Lowry. A disturbingly high percentage, as we know, of the heterosexual cases of AIDS is from minority groups. How do you account for that?
Well, first of all, I think, as I said earlier, poor people, people who are disadvantaged and can't take advantage of opportunities for health care, always more vulnerable. When America as a whole has a recession, the black community has a depression. When America as a whole has a bad cold, the black community has pneumonia. And so I think we're seeing it reflected in this malady as well. I think IV drug abuse accounts for a great deal of the heterosexual rate in the black community. A large number of women and their children have been infected by drug abusers who pass it on through sexual intercourse or through drug or the use of dirty needles with them. And the multiple partner syndrome will continue to make it spread unless we develop lifestyles that are monogamous and reject drug abuse.
Okay, Dr. Lowry, thank you. Dr. Fauci, how do you define casual contact, and what are the risks of contracting AIDS through casual contact?
Well, I guess it's probably best to describe casual contact as anything other than the 3 major ways that you can transmit the virus, namely by sexual contact, by blood or blood products, or by mother to child intrauterally or perinatally. Everything else you can really consider to be casual contact. And the risk of getting the AIDS virus, HIV, from casual contact is really essentially 0. For example, the chances of our getting the virus sitting here in a casual way next to Terry is really essentially 0.
You realize that there are an awful lot of people out there who don't believe what you just said. But we'll continue on with that in just a moment. Part of the myth that we're talking about, John.
And we're going to get some idea as to how many people might be out there. We want to know what you think about AIDS. Each half hour, you have a chance to answer an important question about AIDS by calling a 900 number. The question now is, are you convinced that AIDS cannot be spread by casual contact?
The topic is the spread of AIDS, and our first question comes from New York. Go ahead, New York.
I'm a parish priest in Bayonne, New Jersey. In the past several years, worshipers have been able to receive communion under the form of the consecrated bread and the consecrated wine. Many communicants receiving from the same cup. The question has been asked, if a person who has AIDS drinks from the cup, do those people following him or her receiving communion have any problem or any worry about receiving the AIDS virus in this way?
Interesting question. Who would like to respond? Dr. Fauci.
The answer is no, but it's a complex situation because you get into the whole idea of the virus and saliva and people extrapolating the heavy exchange of saliva in the sexual context with little droplets of saliva that, for example, you might have when you talk or cough or even share glasses or what have you. The virus is contained in saliva, but in a very, very low incidence of individuals who are infected with the virus. The scientific data that argues very strongly that there's not a risk that the Reverend was mentioning with regard to a cup is that there are studies in families in which one individual might have AIDS or be infected with the virus, and there's sharing of utensils, toothbrushes, dishes, food, sleeping together, playing together, bathing together, and there is no evidence at all that the virus is transmitted under those contexts. So if you extrapolate that to the situation we have here, then the risk is minuscule, if any.
All right. Yeah, Terry, did you want to make it?
Yeah, I can tell you when I was working, when I was obviously infected but didn't know it, many times on the job, we'd share water jugs, or whatever. And I know a lot of people who have done that after I have done it. And none of them are coming through, with the disease. So I tend to...
The risk seems to be very, very minimal.
Yeah.
Obviously, Dr. Renee?
Just a quick one, and I think Tony will back me up on this. There have been a number of bite cases, some of them very deep bites, and nobody yet has turned seropositive who didn't have some other risk factor. So, and biting, of course, is much more serious than drinking out of a cup.
Okay. All right. Thank you very much. We will now go on to Nashville for another question. Go ahead, Nashville.
Carmen Bumpus, and I'm a student at Tennessee State University. My question is, since medications are passed from a nursing mother to her baby, can AIDS be spread through breast milk, and what are the chances of an infected mother giving AIDS to her baby?
Okay.
There is a single case of highly suspected transmissibility, not in this country, in Australia, I think, of breast milk being the vehicle of transmissibility. It is probably very low, but even though it is very low, the recommendations are that if a mother is, in fact, positive for the virus, that she not breastfeed her baby.
So that when we talk about babies who do, in fact, have AIDS, these are the children of women who were infected with the virus before they actually conceived the child.
And the mode of transmissibility is very likely for the small exchange of blood from the placenta to the baby, or perinatal.
But all babies of mothers who are HIV positive do not develop AIDS. It's between 30 and 50%.
50%.
50% now.
Okay. Now, let's go on. Did that answer your question?
Yes, it does. Thank you.
Okay. All right. Let's follow up now. We have another question in Los Angeles. Go ahead, Los Angeles.
Yes. I'm curious as to how the AIDS virus exists in open-air environments. I'd like to pose that question to the doctors on the panel.
What do you mean by open-air environments? Could you be more specific?
Okay. Does the virus itself exist in open-air environments? Because the way it's normally transmitted is through closed systems. If it gets exposed to air, does that lessen its impact?
I think you got to be careful when you say open-air environment. Do you mean that it sort of floats around in the air, or do you mean if you take a culture of the virus and you leave it on a table in a petri dish, the virus might survive for a period of time there, but that doesn't tell you anything new or different about its transmissibility. Whether it survives 1 hour or 5 hours or what have you, the fact is it's still transmitted by sex, by blood or blood products, or by mother to child. And we often get confused because you might read a small little letter or an article in the newspapers to say that some scientist somewhere took the virus, put it in a petri dish, and came back 3 days later and was able to culture it. That very well may be the case, but that doesn't tell you anything more or less about what we already know about its transmissibility.
Okay, we've got a question here in our studio, and John.
Yes, this lady says that what this gentleman in Los Angeles said, and the answer actually prompted your question.
Yeah, well, it's not a question as much as a statement. AIDS is very difficult to catch. It does not live very long in the air, and I think what has not been said here tonight is that there are many, many kinds of sexual activity. They do not all involve penetration. Many kinds of sexual activity are still safe.
We have said that on 2 or 3 occasions. In fact, when we were talking to the folks at the Mustang Ranch, it was brought up. In passing, I think some of the folks maybe have laughed a little bit when I did bring it up, but nevertheless, it was brought up, and I think in our discussion here with some of the panel it was as well. Back to you. No, we're going to do, in light of all this, There, of course, is nevertheless a lot of concern about casual contact. This excerpt from an educational film called Sex, Drugs, and AIDS tells how people cannot get AIDS.
AIDS is hard to get.
All-night dialogue on the spread of AIDS.
And we have the results of our 900-number survey for this half hour in answer to the question, are you convinced that AIDS cannot be spread by casual contact? And it's close. 51% of those calling in said yes. 49% of those calling in said no.
Folks, obviously there's a sizable segment of the population that simply doesn't believe what you have to say.
Again, let's underline what Dr. Fauci said. We have lots of evidence from families who have been closely taking care of AIDS patients who are highly infectious, taking care of them on a daily basis, sharing dishes with them and drinks with them and so forth, and there's not yet a case of catching the virus under those circumstances, as long as sexual contact, IV drug use, and sharing needles is involved.
Whether you mean to or not, when you say there is not yet a case, you are implying at least a slight reservation there, in some people's minds, I suspect.
Yeah.
Dr. Fauci?
When you talk about what do you mean by completely risk-free, I think this came up before. In biology, you can never say absolutely never, but the risk is, if you want to have a comparison that people who are up at this late in the evening might understand, that the chances of somebody getting it with casual contact, the chances of my getting it from Terry are probably less than that light falling down and hitting me and killing me. So, I mean, it's a very, very small chance. You can't guarantee me that that light's not going to fall down on me, but I'm pretty sure that I'm pretty comfortable sitting here.
I'll show you my faith in what you have to say.
If I could say one thing, the proof is in the families and the people that take care of people like myself. If it was going to happen, it would be happening. I mean, you don't have to worry about us, is what I'm trying to say. If you think you do, you're living in a fantasy. The information says I worry about you. You don't worry about me unless I don't like you for some reason, which I would never do something like that, but that's what's going on. I couldn't believe the results of that question.
Let me shift gears just for a moment, because Dr. Lowry wanted to respond to our students in Daytona Beach. I don't know exactly what it was you wanted to say.
Well, I think they might be interested in knowing some of the workshops we've held at SCLC have involved college students to a large extent. On one college campus, 9 young women were infected by one young man who has since died. I think you ought to know that happened on a college campus, and that you might take a little more serious perspective on this question than you seem to be taking at this point.
Folks, in Daytona, there is a little bit of a lecture that has been delivered to you. How do you respond to that?
It's not that it's not being taken seriously. It is. It's just not by all people. The education is there. It's just not the students stepping forward to receive it.
Okay. We thank you for joining us. Renee?
All right. This is the AIDS Connection, and the dialogue continues.
The Surgeon General. I've written a report on AIDS that I'd like you to read. It puts to rest rumors about catching AIDS through casual, non-sexual contact. It explains how the AIDS virus spreads, mainly through sexual contacts and injecting illicit drugs. It tells you how to avoid AIDS. Be informed. For your free copy of my report, write AIDS, Box 14252, Washington, D.C., 20044.
This is the AIDS Connection, an all-night dialogue.
Is about the treatment and prevention of AIDS.
Some people with AIDS have turned to home remedies and other non-traditional cures. Is this an act of desperation or a valid choice?
Talking about the search for solutions are groups of people from all around the country. In the New York area, we have a late-night TV studio audience. In Houston, at the Baylor College of Medicine. In Los Angeles, there is a group gathered at a hot spot on the Sunset Strip. We'll also talk to our studio audience here in Minneapolis, where we also have a panel of experts to answer questions. And we will also visit with some students in Nashville, students at David Lipscomb College.
Okay, is there a cure for AIDS on the horizon? What about a vaccine? The race is on in the search for solutions.
If we get a vaccine against this virus, I honestly believe it will open up vaccinology to a whole host of other viruses, and spin-offs will be enormous.
Research on a vaccine continues. Human tests are expected to begin early next year. To date, only one drug, AZT, has brought relief to AIDS patients, but it's only extending their lives.
This is AIDS. What you are looking at is a new generation of AIDS detection technology. The test is called Confirm AIDS, and the medical community calls it revolutionary.
Our test is the first test that directly detects the genetic component of the AIDS virus. You can actually see the presence of the virus itself on the microscope slide.
It's, if you will, a new technology, unrelated to anything that's gone before. It's a completely different principle. It has tremendous potential specificity, and it works.
We're alleging that he is offering a treatment that uses an unapproved new drug. And in this case, that drug is urine.
We are certainly not offering any cure for AIDS, but we are offering a means of somewhat putting them in a state of stasis. I mean, and raising their...
A state of stasis?
In other words, stability.
The bottom line, I think, is that he's offering false hope for people who are led to believe that if they take this treatment, they will not acquire AIDS.
Together now, let's release from our consciousness all fear and anxiety, all anger and resentment.
Joey begins his days now with meditation, part of his drive to save his life, not with Western medicine, but with his own internal energy.
If you were in a car crash and your legs were completely crushed and they rebuilt them and everything, unless you have the will to walk again, unless you say, I will walk and I will dance and I will be fine, it's not going to happen. You have to, at some point, the physical medical care stops and you have to pick up the ball and run with it.
You believe your will can keep you alive?
Yes.
Our panelists in this discussion are Dr. Anthony Fauci, who administers federal funds for AIDS research, Terry Connor, a person with AIDS, and Dr. Irvin Silverman, president of the American Foundation for AIDS Research. Dr. Fauci, who or when can we expect a vaccine for AIDS?
Well, if we are going to have a vaccine, if we are successful in developing a safe and effective vaccine, the early testings will start this calendar year. But given the nature of this particular virus and this disease, if we are going to develop it, it probably will not be until well into the 1990s, probably mid-1990, 1995. It just will take that long if we're successful.
Lightning could strike, possibly, and it could be found before then.
Yes, unlikely, because when you're talking about finding, you have to test it in a large number of individuals, and the situation in which you have a virus whose incubation period is so long, in which there is behavioral manifestations that need to be changed when individuals are avoiding infection. You have to take that into the equation. It becomes very complex. It's not like just testing an influenza vaccine where you know from one winter to the next whether or not it's effective.
I got several more questions for you along that line later, but right now, Terry Connor, what kind of treatments have you undergone?
Well, I've been undergoing the AZT. I was just recently stopped taking it for the third time because of all the people that it does seem to do real good things for, I happen to be one of the ones that it does real bad things for. Although I felt the tremendous effect from the drug, I really felt, I remember trying it for like 6 weeks, and then all of a sudden I woke up one day and I just felt fabulous. At the same time, all my blood counts dropped. That's the only thing, as far as the AIDS, that I've been treated for. I have a thing called MAI, which is another thing you can get from having the AIDS. It's kind of like the pneumocystis. Everybody has it, but your body kills it off, mine doesn't. And I'm taking pills for that. But other than that, it's just been the AZT.
Speaking of AZT, just this week, a study published in the New England Journal of Medicine, a study that was conducted, I understand, by Dr. Margaret Fischel at the University of Miami, indicated that those people who were treated with AZT, that over a period of time, I think it was 9 months, 12 months, whatever it was, a relatively short period of time, but the death rate among those people who were treated with AZT was significantly lower than those who were not. Yes. 4 to 6 times lower, I think that was. What are the implications of that as far as you're concerned?
Well, I think they're very good. Of course, as Terry's saying, it's not a drug that's without toxic effects. And hopefully there will be new generations of drugs. In fact, there's some being tested now that is well without the toxicity. But if we talk about a cure, I think in a sense it's a misnomer because the virus takes over the cell, over the genetic makeup of the cell, and it becomes part of the body. We may be able to suppress it so that people can live a normal life, much like you take insulin if you're diabetic or pills for hypertension, high blood pressure. So there can be ways, we hope, that we'll find that will allow people to live normal lives. But a cure is a misnomer.
But nevertheless, you do have faith that a cure will eventually be found.
I have faith that a treatment will be come along that will be very helpful, very significant, and I feel better. There's light at that end of the tunnel. I just don't know how long that tunnel is going to be.
You're going to be asked to elaborate on that a little bit more later in the program. Renee?
Until there is a cure for AIDS, a lot of people are asking, how can I protect myself? Should we quarantine people with AIDS? Now, this is going to be interesting.
We're going to our first question in Los Angeles. Go ahead, sir.
Yes, I'd like to know what's being done to coordinate the massive effort that's underway right now in AIDS research.
Well, there's the man.
Go ahead.
Yeah, there's coordination at several levels. The Public Health Service, which is the agency of the federal government, the main arm of the federal government responsible for AIDS research, has an AIDS executive committee that meets very frequently, and individuals, representatives like myself from the NIH, individuals from the Centers for Disease Control, the Alcohol, Drug Abuse and Mental Health Association, HRSA, and a variety of others, the Surgeon General's office, meet and coordinate very closely the activity of the different agencies. And then within each individual agency, such as the NIH, the CDC, etc., there's coordinators who coordinate the research within the given agency.
If more money were expended for AIDS research, would it be reasonable to assume that would hasten a preventive vaccine or even a cure? Are we suffering as a result of a lack of research funds?
At the present time, likely not. I think now in 1987, 1988, for example, the budget for the NIH and just research alone for 1988, the proposed budget will be $425 million. And that's just the NIH, and there's the CDC, et cetera. So there's going to be somewhere short of $1 billion that's going to be spent in 1988, including all of the agencies. You never know for sure if more money is going to make things faster, but I think things are moving along very, very quickly right now because of the large infusion of money.
Okay, let's go to Houston now for a question. Go ahead, sir.
I think one of the things that people have to realize is that we only found out about AIDS just over 6 years ago. The amount of progress which has been made in that very short time is truly remarkable. We know what causes the disease, what the risk factors are, how the cause is transmitted, We already have the beginnings of a drug program which at least shows some hope for helping people. There clearly is a lot of frustration, particularly in the people, for the people who have the disease, about the slowness with which drugs are coming into trials and with which drugs are being made available. And I think that's the biggest problem that we have to face now, is not the fact that nothing's being done, but it's being done desperately slowly because of the necessity for getting things done correctly. It's no good just throwing drugs into trials and making them available for huge numbers of people if you don't really know what you're doing and you have no way of assessing the results. And this is the sense of frustration that I feel as an individual who's intimately concerned with clinical trials for trying to help people with AIDS. It's not that we haven't come anywhere, it's that we seem to be going to wherever we're going rather slowly, but people have to realize what a very short time we've had to do this in, and what a tremendous amount of progress has already been made in that very short time.
With your question, you pose a question that I'd like to present, perhaps to you, Dr. Silverman, that the gentleman just said we've only known about AIDS for 6 or 7 years. That's not quite true. AIDS has been known 6 or 7 years, or whatever it is, in this country. AIDS has been a tremendous problem in other parts of the world, specifically Africa. Why weren't research efforts initiated that were formidable before now?
Well, because the cases that we're seeing in this country were seen at about the same time in Africa. It appears from looking at bloods that have been stored in Africa that maybe the virus had been around maybe 10 or 15 years longer. But if you look at the number of cases and when they were recognized at just about the same time. I think Peter Mansell, who was just speaking, made a very good point. If you look back over the past epidemics, it took thousands of years before we knew anything about the plague. It took another 35 years before we knew what to do with it, how it was transmitted, another 10 to get a cure. Here, in 6 really short years, we've gone incredibly fast. Not fast enough for Terry right now, not fast enough for a lot of people, but it has moved very quickly. There's still a great deal that needs to be done, and I think society assumes that we know all the answers, we can come up with the cures, and I think everyone's a little distressed that modern medicine hasn't got the quick fix.
Let's go to New York right quick. There are 2 gentlemen that are standing by, Tom Cunningham and Tom Hannon, who are associated with an organization called Health Education AIDS Liaison. What exactly is that? HEAL for short.
HEAL stands for Health Education AIDS Liaison, and what our group is about is we saw very early on in the epidemic many men taking control of their health, many people who didn't want to be AIDS victims per se. As with most any disease, people who get involved in their recovery, people who take care of themselves and have a tremendous will to live, the course of the disease will be much better for them. We saw people breaking all the rules, living much longer than the predicted life expectancy, and they were using diets, meditation, visualization, things that were not considered mainstream medicine. Let me show you some of this.
I don't think we're going to have time for you to show us that, Tom. I'm sorry, but I would like to go ahead and take what you've said so far and turn it over to our panel and see how they respond to this type of care. Do you think that what these gentlemen are doing is worthwhile?
I think holistic approaches have a place in medicine, and I think taking good care of yourself, good diet, avoiding situations of the kinds of physical and emotional stress that might have some direct or indirect effect on the immune system is helpful. It can't be the primary way that you rid yourself of the AIDS virus. What you need to have if you're infected with the virus is what we're all trying to get, and we've made some great deal of headway, and that is a safe and effective antiviral agent. But the kinds of alternative approaches that these gentlemen mentioned do have a place in the proper context.
You're not suggesting that that is the primary way in the first place, are you? You're talking about this as or are you?
No, we're talking about this as being an adjunct to medicine.
All right, gentlemen, I'm sorry that we have to shortchange you just a little bit. Things got a little bit behind at this point. Thank you very much for being with us. Renee?
More about the search for solutions in a moment, but first some thoughts on where the answer might be.
Must one man have before he can hear people cry? How many breeze blowing in the wind.
Continuing our national all-night dialogue on AIDS and the search for solutions. And we have a question from Houston. Go ahead, Houston.
My name is Chris Cannell, and I am president of the local PWA Coalition of Houston. I'm also co-chair of the National Association of People with AIDS. I think it's very important to let people know across the country with AIDS and ARC that our organizations do exist in most of the major cities, and we're outreaching to the smaller cities at this time. The National Association of People with AIDS, through our coalitions locally, provide a networking system for people with AIDS and ARC and HIV-positive individuals, as well as their families and friends, so we can share alternative methods of healing and promote a sense of dignity. And at the same time, the most important thing, along with all the medicine and the treatments and the drugs that are available for us, is to become self-empowered. There are many ways to become self-empowered, spiritually, through meditation, through all types of different alternative treatments. And I just want people to know that these coalitions exist from coast to coast, and if you are in need or feel a need to become empowered and help yourself heal from within, please contact the National Association of People with AIDS in Washington, D.C. If I'm be allowed to give their phone number, it's area code 202-347-1317. Thank you very much.
Thank you. And let's go on now to a question from Nashville. Go ahead, Nashville.
I understand that the drug AZT does prolong life for the AIDS patient, but has anyone that has ever taken the drug condition gone into remission?
All right. Did you all hear the question?
Yeah.
Okay.
The drug AZT has been shown to be effective in the study that was just published in the New England Journal of Medicine at prolonging life of individuals who have AIDS, particularly AIDS with pneumocystis carinii pneumonia. When you talk about putting someone into a prolonged remission or, quote, cure, which is not the kind of thing you're aiming for, you just want to suppress the virus so that you can go along in a relatively healthy life. We don't have enough time studying the drug to determine if this remission will last 2, 3, 4, 5 years, because the testing of the drug just started last year. The test was shown to be effective at the end of last fall. The drug was distributed, and now the paper comes out in the scientific literature. So the results look good. There's toxicity.
What's the longest period of time so far that it's been determined?
Right now it's probably somewhat over a year.
That the drug has actually prolonged the life of an individual patient.
Yes.
But we're not talking about an actual cure, and that's something that's very important, because I think a lot of people, they hear AZT and they hear miracle drug, and that it is in fact a cure.
No, it's not. In fact, you wouldn't even hope or expect it to do that. You just expect it to suppress what we call the replication of the virus, so that the body's immune system can either recover spontaneously or you can boost it up by other mechanisms. Since the virus hides in the cell, you want to keep the lid on the virus and keep it suppressed and not replicate and destroy the body's defenses. That's what the drug does. It doesn't rid the body completely of the virus.
And as Terry said, it doesn't suit everybody either, because there are some people who reject the drug, and it is also an extremely expensive drug, is it not? $10,000 a year? In order to pay for AZT. And so obviously we're not talking about everyone being able to take advantage of the drug. Now let's go to our own studio here, where we have a question from our audience. Go ahead.
Yes, this gentleman has moved from 1, 2, 3, 4 seats in order to get in the position to ask the question. Go ahead, sir.
My question to the panel is, what information about the being HIV positive would you like everybody, the entire public, as well as those 90% of the 1.5 million people you said who don't know they are HIV positive, to know about their chances of survival? What should they be doing to be not only in regards safe activity, but to survive, to live?
Well, there are two things. The first that you mentioned yourself is the most important, and that is counseling how to protect your sexual partner, to avoid situations where you may give blood or share needles or what have you, to avoid the transmissibility to others. You alluded to that yourself. With regard to what you can do for your own longevity. I think healthy living, avoiding the exposure to the kinds of other infections that might trigger the replication of the virus itself. There's some interesting new data that's come out that if you activate the body's immune system when you're infected, that you can actually trigger the turnover or the replication of the virus. And probably as important is that there are tests going on right now, clinical studies, to determine the effect of these agents like AZT on people who are asymptomatic, namely they're infected with the virus, but they don't have any symptoms. If those studies prove to be effective and safe in those individuals, then it will become very relevant to know if you're positive, because then you have a means of therapy that would be available to you.
But the kinds of things that we've been saying for years to everybody, adequate rest, exercise, good balanced diet, and the one that's most difficult with all of this is trying to reduce stress, can help. And it seems to help, and it's the kind of thing I think Terry is, who knows he's infected, you've done some things that made you feel better.
Absolutely. Getting back to the video and what the other gentlemen were saying, I haven't been as healthy as when I started. Every night before I go to bed, I send whatever you want to call them, tracers or whatever, after this disease in my body. And all I can say is, here I am. I was a lot sicker 2 months ago, and I believe in the power of the brain. You know, it makes a big difference. There's no doubt it makes a difference. And to anybody out there that has this disease, I'll tell you, it makes a difference. You have to control it. I mean, there comes a point where you probably won't have a choice. But until then, go for it. Live your life and be positive about it, because there's no other way to live your life, if you ask me.
That's a tremendously important point, and one of the issues that we were discussing when we were up there with some of the audience members was the whole aspect of getting into not just medical questions, but psychological, emotional questions in terms of how you deal with the disease, that those kinds of questions can be just as important as scientific questions. How the patient or the person thinks about himself and about the disease, and what you're saying seems to be very encouraging.
And that's why it can help if people will be compassionate and sensitive and show compassion and sensitivity to people who are infected, who may have AIDS, because it's very difficult to have this frame of mind when people are shunning you and turning away from you and not touching you.
Fantastic. Thank you. Thank you very much for that. John?
It is time to remind you, though, that you can call with a yes or no answer to that question. Should we quarantine people with AIDS?
It's a lot harder when it's someone you know or someone you're close to. And it's worst of all when you lose someone you love unnecessarily. Many people think that AIDS doesn't affect the black community. It does. And what you don't know can hurt you and those you care for. You don't have to be white or gay to get AIDS. Call this number to get the facts on AIDS and how you can prevent it.
A national dialogue on AIDS and the search for solutions.
Renee, I don't mind telling you, I'm somewhat astounded by the results of this poll. We do want to emphasize, of course, it is not a scientific poll, but here are the results from our survey question. Should we quarantine people with AIDS to control the spread of the disease? 47% of those who called in said yes. 53% of those who called in said no.
I am also a little taken aback. We have been talking about compassion, understanding, and this is an honest response, obviously, that we're getting from some part of the audience. How do you respond to this?
Well, with frustration, because most of us have been spending the last 6 years trying to get the message across to people. I think there's several things so that people will know. Even if it made public health sense, we couldn't do it, because we'd have to test everybody in the country every 3 months, and everyone who was positive would have to be sent somewhere. And if there's 1 million or 2 million, we'd have to take over San Francisco, New York, or a place like that. The cost, I mean, it's conservative liberals, you couldn't do it. The fact is, from a public health perspective, it makes no sense. This is basically a disease of consenting adults, and unfortunately consenting kids in some extent. If we can educate, and if people will listen to what we say and follow what we say, we can stop the spread of this disease tomorrow. It's a personal, individual thing. If you are positive,
If I don't have sex with you or share needles with you, I don't have to worry about it. So isolating you, quarantining you, does nothing. And I don't know how we're going to get that across to people. And I guess what it is we failed. The emotion is taking the place of intellect. And
Terry, how do you respond to this? This must make you a little crazy, huh?
They're going to have to take me kicking and screaming, I'll tell you. First of all, I would like to know that these people that said yes, first of all, have they ever known anybody that's had the disease? I'm sure that'd make a big difference on how they feel. Second, it's just, I just get very upset that amount of people, aren't they listening to us? Do they think we're just doing this for fun? Because we,
not at this hour.
Right, not at this hour. You know, we're here to let them know that you don't have to worry about me unless I go on some kind of rampage, which I haven't been known to do recently anyway.
Well, obviously the educational process has to continue because there are a number of people out there who have not gotten the message, or in fact, as I said to Dr. Fauci earlier this evening, don't necessarily believe all that we have been saying tonight. But let's go to John.
This is the AIDS Connection, and the dialogue continues. An all-night dialogue live from across America. I'm John Hambrick.
And I'm Renee Poussaint. In this segment, we will talk about the global dimension of AIDS and its impact on the United States.
AIDS is spreading worldwide, but how great is the threat? Should we close our borders?
We'll hear opinions from people all around the country, from a New York television studio audience, from a group pulling an all-nighter at David Lipscomb College in Nashville.
I've also asked HHS to add the AIDS virus to the list of contagious diseases for which immigrants and aliens seeking permanent residence in the United States can be denied entry. They are presently denied entry for other contagious diseases.
There is another reason that AIDS is spreading so quickly to the general population in developing countries, the lack of education.
With 80% illiteracy, it's very difficult to explain to someone what a virus is, so that something that he can see is actually in him, and that he can transmit a germ like that, although he may be perfectly healthy.
A four-part strategy has been devised comprising public education, public health measures, research, and the development of caring services.
We are developing ways of treating patients. We are helping in terms of the community as well, trying to provide community help for those suffering from AIDS.